Hello, beautiful people. We're going to talk about what to do if you have a heart attack. Would you know what to do if you, a bystander or family member, were having a heart attack? We've spoken about the symptoms and the signs of a heart attack in the part 1 of the Heart Health series. And today we're going to talk about what the next steps are going to be when you or someone else nearby is having a heart attack. I am Dr. HMS, and I welcome you once again to the Medical Information Channel. Do comment below in the comment section to let me know what you think of the channel and what other topics you'd like to be discussed. Like, subscribe, share, and click on your bell notifications if you haven't already done so before now. So what is the first thing that you should do? Call your emergency medical service. In whatever part of the world you are, there should be some form of emergency medical services. So please, if you're able to reach out to them, quickly call them as soon as you can. Be ready to explain to these emergency medical personnel what has happened and where you are, where your location is. Stay calm and follow all their instructions as quickly as possible. I know it's not easy to stay calm. However, please try and do so. If you don't have access to emergency medical services, because we're all aware that sometimes a person may be in a position where their location is not amenable to accessing emergency medical services on the phone, then please have someone drive you to the nearest hospital as soon as possible. A friend, a neighbor, a bystander, someone in the house, please let them drive you to the nearest hospital as soon as possible. Do not waste time because your condition can worsen. Don't drive yourself because driving yourself will put you and others at risk. Please don't try that. Now, if you have any prescribed chest pain medication from your doctor because of some heart condition that you have, take the prescribed chest medication. But remember that aspirin can interact with other medication. As a person who is going to take aspirin should always have the information at the back of their mind that diclofenac, ibuprofen, naproxen, and other non-steroidal anti-inflammatory drug medication can interact with this aspirin. The 300 milligram tablets of aspirin are usually given. Now, please do not take aspirin together with ibuprofen and other similar drugs that I've mentioned before in that category aspirin, because the ibuprofen and these other drugs can make the aspirin less effective in protecting your heart and your blood vessels. Also, the combination of these medications can increase the risk of you having a stomach bleed. Please do not delay in calling 911 to take an aspirin or your chest pain medication that has been prescribed by a doctor. Call for emergency help first. You may have taken glycerol trinitrate spray or tablets, but if this hasn't helped within 5 minutes, other measures may need to be taken. Please remember the importance of taking this medication. Take it now. Take it now, as soon as you're suspecting that you're having a heart attack. Do not waste time. Why do we take aspirin during a heart attack? You may want to know. Aspirin could reduce heart damage by helping to keep your blood from clotting during this episode of a heart attack. Some people may be allergic to aspirin, so if you're not allergic to it, it has this advantage. If you are alone and you've called emergency medical services, you've taken your medication, and you should open the front door and sit near this door. Sit calmly until help arrives. You can also call out, shout, so that people nearby can hear you and rush to help. If, as I mentioned before, there is a witness to the attack, he or she should, while waiting for the team to arrive, talk to the person and reassure them that help is on the way. Tell them to keep calm, encourage them to rest, sitting down. Loosen any tight clothing they may have on, maybe a tight-fitting shirt, a tight-fitting tie, and let them sit still. Ask the person takes any chest pain medication, such as nitroglycerine, as I mentioned before, for a known heart condition, and help them take this medication. Get them a glass of water and let them take this aspirin or any other chest pain medication. If they become unresponsive at any point in time during this period, maybe this man or woman may be having a cardiac arrest, which is a medical emergency, just like the heart attack. However, as we all know, cardiac arrest is a more severe entity. So please prepare to begin cardiopulmonary resuscitation on this person. If you see someone who's unconscious from a suspected heart attack, I'll mention again the steps. First, call for emergency medical help. Check if the person is breathing and has a pulse. If the person is not breathing or you don't find a pulse, only then should you begin cardiopulmonary resuscitation. We should all know how to perform CPR. It is essential for human life. If the victim has a pulse and is breathing normally, however, monitor them until emergency responders. Maintain the patient's airway and begin rescue breathing immediately. Do we know what rescue breathing is? Have you heard of rescue breathing? So rescue breathing is a type of first aid that's given to people who have stopped breathing. And there is a technique to this. During rescue breathing, you blow air into a person's mouth to supply them with the vital oxygen that their lungs need. Rescue breathing can be done alone or as a part of cardiopulmonary resuscitation, CPR, as mentioned prior. So look out for part 3. Take note of some of the points in reducing your risk of having a heart attack. I hope you enjoyed the presentation, and I look forward to your feedback on the Medical Information Channel.